I'm very, very excited. All great energy out here. And thanks to Dr. Silverman. She has done all actually the difficult part for me and made it so easy talking about NRF2 and oxidative stress and the science. Uh, don't worry, I'm not going to talk anything in some cardiology jargons. What we're going to share here today is, because what I understand is there are this is like for all the people in the world, and a lot of people who are non-medical are over here. So, and that is what I'm excited in Life Vantage, that anyone who is interested in health and wellness is over here. And I'm so happy to share my message today. So since I'm new and I have great and amazing team, I'm going to like a little bit put up on what I've been doing as a preventative cardiologist, and what excited me about this NRF2 technology, and what is my vision related to this, where we will be going in future, and why I have chosen to be a part of Life Vantage. And I just want to make a disclaimer that these are my personal views about the product. We all know that Protandim is not supposed to prevent, treat, or cure diseases, which is over there here. But whatever I'm sharing is my experience and my knowledge. And because I've worked with these ingredients over 20 years, because having active practices in India, I've used a lot of this in my practice, and how I find Protandim as a different product. So I'm going to share my views and science, and this is independent of Life Vantage. These are my personal views. So I'm just before I start sharing, I just wanted to have a disclaimer. Okay, so here we go. Have fun, because I don't think so cardiology is that much we get all scared with heart attacks, and we all think heart means we're going to die, but that's not true. Because what I found IPC Heart Care is our whole mission actually is like, to save people from heart attack and open heart surgeries. And because of my global initiative, like I came to US and have been working here since last 4 years. So today, like what Dr. Silverman told me, is to share about oxidative stress, cardiovascular diseases, and how NRF2 activation will help in prevention or the people who have got heart diseases. So let's go ahead. One sec, I'll just go to the next. Little bit stuck. Yeah, I got it. So let me make it very simple, because I want this to be an education for the layman, because we all talk about heart disease. Heart disease could be like lots. It could be like valvular problems, like something like cardiac fibrosis, myopathies. But the main chunk of heart disease is actually coronary artery disease. Almost 80% of them, what you hear about people dying or a sudden chest pain and all. So what actually happens in this heart disease, and I feel it is very, very vital for each one of you to know this, because like if you look at the statistics out here, like almost 70% of the people are getting heart attack as a first symptom, and half of them don't even survive. So I think the people who are waiting to get symptoms and then act upon are actually manufacturing the disease. And that's where I see a role of Protandim in prevention, because I feel that I'm going to share about it, that how it is going to be later on. But I would like to make this problem statement, because this is something which is very serious, that like I know Dr. Silverman is great in cancer, and she wants to eradicate cancer, and she doesn't want to give the bad news. So same way I chose to be in preventive, and I've been like almost so many years, or more than 20 years, I've always been delivering the good news. Luckily, I chose this at the beginning of my career, because what I realized that it is the #1 disease in the whole world, almost 40% of the deaths, twice the mortality due to all types of cancer. So it is actually larger than cancer. And though US has got the best medical system in the whole world, which we are proud of, still 735,000 people are developing heart attacks, out of which 525,000 are the fresh ones, you know. So I feel that we and our all teams and all the people here at Life Vantage have a big role to play, because there are so many people out there who are needing our help, and I'm going to share to you that how we can help them. Okay, so stay on. Okay, so what I'm going through is just a little bit what you must have done maybe in your high school days in biology, a basic like heart. We know that all, like, the aorta is the main pipe which supplies blood to the whole body, and heart has its own unique blood supply, which is the left coronary artery and the right coronary artery. And the left coronary artery, one comes in the front, which is the LAD, which is also referred to as widowmaker arteries by the cardiologist, because if you get a heart attack over here, the chances of dying are very high. And one which goes behind, which is LCX. Now, why I'm sharing this is that when we talk of blockages, like, what do we mean? Like, you know, we say that the heart has got blocked, the arteries have got blocked, and what oxidative stress has role to play, you know. And we need to understand this, so that whenever we are talking to people about heart disease prevention, at least, you know, anybody who is interested. Now, I'm also going to talk about our target audience, whom we can reach and how we can reach. So just first understand the basics, that when we are getting a heart attack, which is a complete closure of the artery, it's like a warning thing, right? Like 911, hospitalization, and all the surgeries. But just look at here, like, when does this disease start? The disease starts from the teenagers. You know, they did a research like in the teenagers, and they found the fatty streaks in them, you know. And in fact, they did studies in UK, and they found out that in the infants also, like, how the cholesterol. So when we do actually a screening and we find cholesterol and all those things at a adult stage, it is not that at that point. It starts at a very young age, you know, and the blockage keeps on developing. And unfortunately, when the blockage has developed more than 70–80%, that is where the symptom starts. So what excites me is that we have a huge window of prevention. We have got a lot of young people out there, and, you know, like, people out there who are manufacturing the disease. And it's not that we have to wait for someone to become a senior and talk about heart health. I always say that prevention is from womb to tomb, and I'm going to explain you how. So what I have been working on all my life is how the blockages progress and how to reverse them, you know. And I have done a lot of research and work related to it. I'm not going to it, but that is my passion, and that my passion to learn about this has led me to this product of Protandim. Now, if you look over here, this is how the cross section looks. Maybe we can find our burgers over here, or steak, or a lot of stuff, you know, we keep on eating, yes, and we don't know what's happening, right? All those like fatty food and cook, and, like, you know, we're just enjoying ourselves, and this is what happens inside us, you know, and we just don't know. It just keeps on developing. But I tell you that people get scared of heart, but I say that heart is the best organ. Heart keeps on tolerating, you know, all the things which we do wrong to ourselves. We eat wrong food, we don't exercise, we shout, we are impatient, we are intolerant, you know. And this little guy, which is hardly like, you know, the size of a fist, or 250 or 300 grams, like, you know, it just takes on all the brand, you know. And what we are seeing over here, that a stage comes when suddenly there is a rupture of that block, and boom, we know that we have got an attack, you know. And I'm going to later on show that what Dr. Shweta said, that how our NRF2 activation is going to prevent all these things. So I'm going to show you a little bit on that, but I want you to get this common man story. This is what people just know, that okay, heart attack and this, but I just wanted to understand that how this develops, you know. So basically, the reason why I'm here, and I'm so excited that all of you are here, I think we have to attack the heart attack before it attacks you, you know. So prevention is always better than cure, and that is what we are here for, and as Dr. Silverman said, we all have tools, we know about the low fat, like vegetarian diet, and, like managing stress, and maybe we can do yoga, meditation, or exercise. But I feel that what we have, Protandim, is a great tool which helps, in addition to all these things, because I'm going to share that I have worked with this for last 20 years, and when we have a tool like this, we can give such amazing results the way this science is all about. So if you go next, now generally I'll tell you that as a preventive person, I know all of you must have gone through this, right? When we see something like this, we get so excited, we go all out, we tell our friends, we go and talk to doctors, and we talk to everybody, and they're not excited like us. And you feel so bad, and you feel that, like that rejection. But I tell you that just don't worry, it is all about them, it's not about us. Because the problem about prevention is that very few people understand prevention. So I will just take you a little bit through the stages of prevention, because one is, we talk about the primary prevention, which is in young children and young infants. That is where I feel that everything should begin, like we should be doing these products with our children. Like I have got my young girls, I started with them to, like, why then should we wait till they get old, and especially thanks to Kerry Williams, she motivated me a lot, because I was thinking it is after 18 this we can use it, but she just has been using on Luke and her kids. So and I heard that amazing story. So I feel that we can really help young children and young adults. Then we have got the secondary prevention, and I think this is a group which will be little receptive, because I always say that what Kerry Dickey says, that you feel the person and what pain that person has or what that person needs. So when we're talking to people, high risk group, which is people who may be having high cholesterol, blood pressure, diabetes, people who are overweight, people who are smoking, all these people are likely to have, like more chances of getting a cardiovascular event. And I think the most receptive group is going to be the people with a heart history in the family, because I've always seen in my practice, that many times when I have young people coming in, I ask them, you are 25, you are 30, why are you coming in now? Because I'm used to seeing old people. So they say that, like my father had a heart problem, and, I lost him at the age of 42. And, I just don't want to be there, so please help me. So I think what happens is that many times, yes, we want to reach out to the most of the people, but the people who are going to be more receptive to our message would be this kind of group, because they already are vulnerable and there is a possibility of an event happening. And obviously the group which is going to be most receptive is already people who have got problem, because they have this nagging pains and aches, and they are the ones like if the system has not given them results, they're going to listen to anything what you say. So that's what I say, that prevention is from home to tomb. Everybody could be we should share our message to everybody. We should not leave anyone, because it will be beneficial. So what we are facing right now, as you see over here, I think we all like the movie Titanic, and we all know about the iceberg. But what we are seeing here is what we are seeing, that 750,000 people getting as a heart attack is just the tip of the iceberg. What is sitting below is this huge population over there. And I think we have a responsibility towards the society, where we have to shout and keep on spreading our message. Don't bother who listens or who doesn't, but just be consistent, and that is what I've been doing all my life. I'm just consistent in what I'm doing. I really, I've lost the count of the lectures and the seminars and the kind of shows I have done and helped people. But what I see is that we should not stop doing good, because this is what we need to track. And we have a powerful product now to help us help this population. Okay, so that is what is exciting. Coming to the group, the baby boomers, the seniors, most of them have this like, you know, like incidence is almost 1 in 4, you know. So I mean, every third person you will be talking about 60-65 would be having this, you know. So uh, this is something which you need to keep some tips with you, that most of them would have undergone a process which is like a angioplasty or a stenting. Now if you look over here, a common man thinks that, okay, I cleared my garbage, which was a blockage. I don't need to take or do all these things because I have cleared my garbage and I have a stent and I'm fine, you know. That's what people think. And or many times they undergo the open heart surgery where they are stitching the grafts. But if you look at this, the root of the blockage is over here. So what happens over a period of time, like I have treated cases where this gentleman had done 3 angioplasties, and you know, like he was told the fourth one in the same area, the stent was keeping on getting reblocked. And I'm going to show you that how you know, like what we are doing can help this kind of people, you know, which, because I'm going to discuss the Ohio State study, you know. So if you look at this, or if you look at even the surgery, the grafts which are put in, you know, again there is a reblockage over there. So what we need to educate the people is that, okay, great, you have done surgery, you're on medications, that's fine, but that does not remove the root cause of the problem. What I'm happy is that we have got something which treats and goes to the root. That is what is exciting me, you know, and that is what we have a great story to tell, you know, because these are the methods which can just like kind of, we say, like elevate the problems, but it doesn't help to go to the root, and there are chances of recurrence. Now my journey started because I was in a country where I was actually having a great life being a hospital owner, because once you're a hospital owner, everything rolls in, you have insurance, all the patients come in, you've got everything what you want on the earth. But what was upsetting me was, like, you know, people coming in the ICU, constant stress, burnout. And that is where I thought that, what can I do to help people stay away from hospitals? I know it is great financially, and it is great, you know, to have a hospital, but can I do something to keep people away from hospital, you know? And that's where my journey as a preventive cardiologist started, where I started teaching yoga and meditation. And I came upon EECP, which I learned from Stony Brook, New York, which is an amazing non-invasive technology to open up the collaterals with the heart. So I did more than 50,000 cases with more than 95% success rate, and they feel better. But now I feel more excited that we open up the collaterals, they do diet and exercise, but we have got something which is powerful, which will help them to go to the root cause, which is always I'm finding. So let's now get to NRF2 activation. You know, this is what I wanted to share about the standard cardiology, what procedures are happening and what issues which we are facing. But now this is something which has excited me to be a part of this amazing team, that it has got very good studies. You know, one of the biggest problem which we are facing currently in practice is, you know, heart failure. It's really bad. Even in US also, if you look at Medicare, in fact, they have given notices that you have to manage heart failure well, because if the patient gets readmitted again within 30 days, you know, there's going to be a penalty on the hospital, you know. So so there is a study by American Heart Association, which was published in Circulation, you know, which was done by Virginia Commonwealth University. And it talks about right side heart failure, and it talks about how Protandim has been beneficial. So, you know, like, yes, again, we are always like, we are not here to like say prevent, treat or cure diseases, but what we are looking at the studies is that where Protandim is having a lot of scope, you know. And to be honest, I am so excited to be a part of this team, because I am going to do a lot of studies in India. I want to do studies in human beings. I am going to, and luckily in India, we have got complementary therapies are accepted, and we can do case control double blind randomized studies. We are allowed to do that. And the main reason why I'm part of this amazing team is that I really want to do justice to this amazing product what we have, you know. And I'm so much excited about it, because we are facing huge problems. And the problems which we are facing of heart failure, repeat surgeries, and there is some term which is known as what we call refractory angina. Now, what is refractory angina? Refractory angina is a group of people where they have done bypass, they have done angioplasty, they are taking medications full dose, they are not getting help, you know. So I mean, we have so much pool of people out there who need help, you know, and we have got amazing product, and we need to work more on it and reach out to people who could be helped by this, you know. So uh, another study which I am very much interested and which really took away my all attention was the Ohio State study, because my common problem in practice which I always face is that, you know, people have done surgeries, and especially you will find this more in the baby boomers, because previously when the surgeries used to happen, they used to pick up the veins of the legs, which is the graft saphenous vein. And if you look at the Ohio State, they have done it on the saphenous vein grafts, you know, and they found out that the grafts which were treated with Protandim, then, you know, they are able to, like, you know, not reblock again, you know. And even angioplasties also, if we apply the same principle, what happens is that actually technically the root cause of the entire blockage is endothelial dysfunction. Now we all understand exothelium, the skin what we have here is the outer part, and endothelium, if you just want to get a feel of it, is something which if you open your lips and touch inside, that is the endothelium. It's a very smooth lining. Okay, so same way our arteries, the internal lining is known as endothelium, and the dysfunction of that endothelium causes everything. So when even surgeries are done, that endothelium, because of the disturbance, is going to keep on producing the problem again and again. And this Ohio State study is so very relevant actually to cardiology, because it gives us a great scientific evidence that how this product is helping, you know, to like, you know, if you want to prevent the reblockages, or, you know, like getting the disease again, it becomes so useful, you know. So I hope that you must have all got that message very clear. And now if you want to go more little technical, I'm sure that, you know, you must be facing people with getting cholesterol and high cholesterol, and I think everyone in US knows about the bad cholesterol, that is the LDL, and the good cholesterol, which is the HDL, and because all of us go through our meds. So the culprit in the blockage is what we call oxidized LDL. Now, how does this oxidized LDL happen? You know, it is all because of oxidative stress. You know, if you look at the root cause is oxidative stress, and now you understand the relevance of what we are doing, that the process from where the whole blockage formation, the plaque formation, what we call starts, is through oxidative stress. Because, and especially they have found out that small oxidized LDL particles are mainly responsible. Now this bad cholesterol, that is this oxidized LDL, it goes and injures an endothelium, and it starts this cascade of lot of response in your cells, which starts leading to blockages. I'll not go into it, but just maybe if you like this, you can take a picture of this, you know. And anyways, Dr. Silverman is doing the recording, so we'll get it. Again, coming to prevention of heart attack, that why do I'm into this? Because what you see, you look at again the plaque destabilization and blood clotting, which is the root cause of the heart attack. Again, if you look at the root cause is oxidative stress, you know, because there is a lot of free radical activity going and a lot of inflammation happening. So when all these things are happening, it goes and makes the plaque unstable, you know. And, you know, like, and that's why, like, one of the thing is that if your blockage is stable and it has got calcification and a good cover, we say that the chances of heart attack are less. So now I think I'm very clear by now that why I'm excited to be a part of this great venture which we all are doing. And I would just like to say that like I think in the Bible in 6.14, it was about the Noah's Ark, that make the ark, you know, like to save the people. So I always like that. I feel that we are making that boat, that ark, for helping